Good evening, everybody. Thank you so much for joining Together Oklahoma and the Oklahoma Policy Institute for the first in our series of conversations that we would love to have with the community in talking about our policy priority areas for the 2021 legislative session. This year, we're going to be thinking about our work in three bucket areas. And those buckets of work are thriving families, safe communities, and healthy Oklahomans. Through doing our work in this way, we are enabling ourselves to be able to think about our communities in a very specific focus on children and families, as well as racial equity work. We hope that you can find yourself reflected in our work as we go about talking this evening. And we are really excited to have you join us as we launch our series through Healthy Oklahomans. Healthy Oklahomans will be focusing our work around Medicaid expansion, implementation, and reversing and hopefully halting managed care. And tonight you're going to hear about the bills, the legislation, the policy work that we're doing specifically in this area through some of our experts on our team. And we're going to turn it over to Kyle Lawson, who is our senior organizer, and will be talking to us about what our Together Oklahoma team will be doing over this legislative session. Kyle?
And thank you, Anawake, for that introduction to this evening. The next series of events that we'll be having that Anawake mentioned, the next one will be the 18th, same time, same location, and then the 22nd, same time and same location. The registration links will be available to those on the Together Oklahoma website, and the links for those will be sent out in advance of those events. The flow of this evening, the first thing we'll have is Emma Morris, the healthcare policy analyst with the Oklahoma Policy Institute, going over the issue with us. And then we will have Nicole Poindexter, our legislative affairs person for the Oklahoma Policy Institute, who will be going over the bills and any issues we're watching at the Capitol around this particular policy area. And then we'll have an opportunity for question and answers after that portion. You're able to, in the comments on social media as you're watching this, drop your question in those comments there, and they'll be sent to me so that I can ask those questions of the experts. And then finally, we'll close with Angela Monson, the Outreach and Legislative Director for the Oklahoma Policy Institute. So with that, I'll now turn it over to Emma Morris to take us away.
Thanks, Kyle. Like Kyle said, my name is Emma Morris. I'm the Healthcare Policy Fellow at Oklahoma Policy Institute. OK Policy operates under the theory that Oklahoma could be a great place to live, a place that provides good schools, jobs, health, and strong communities. But in order to get there, we have to do more to invest our state resources into all of our fellow Oklahomans. So we provide the facts to support this future, and we advocate for fair and responsible public policies. So let's get started. Oklahoma currently has the second highest uninsured rate in the nation. About 14% of all Oklahomans don't have insurance, and that number is disproportionately high in communities of color, as you can see here on this graph. So I want to point out that it's bad across the board, right? But it's especially bad in Hispanic and American Indian communities. It's also particularly high in rural areas as compared to metro areas. And we know that these disparities are results of systemic factors. We also know that because of these huge disparities, this lack of insurance is a racial equity issue as well. You've probably heard a lot in the past few months about how Oklahoma ranks 46th in health outcomes in the country. And it's true, many of our state's health rankings are really, really bad. Oklahoma stands at first in the rate of deaths due to heart disease and fourth in diabetes-related deaths. We have high premature death rates in general, and a lot of Oklahomans are going without needed preventative and other medical care. Luckily, as I'm sure you all know, we expanded Medicaid last June, and this was thanks in large part to grassroots advocates like yourself. Medicaid expansion passed by a vote of the people in last June, as I said, and in July of this year, 200,000 Oklahomans are going to gain health insurance. This is a monumental step forward for our state. This change is going to help increase equity in Oklahoma. It's going to bring increased savings and $2.5 billion in new spending to the state. And it's going to have particular benefits for veterans, people experiencing homelessness, rural residents, and people who need substance abuse and mental health treatment. So, of course, expanding Medicaid isn't going to completely fix all the negative rankings that I mentioned earlier. There is no silver bullet that will move Oklahoma from the bottom 10 in health outcomes to the top. However, Medicaid expansion will go a long way towards getting our state where we all want it to be. And as we can see on this slide, OK Policy estimates that in the first 10 years, Medicaid expansion will pay for itself through savings and additional revenue. You can see on the top part of the graph, the expected revenue and savings, and then the bottom part, the blue part, shows the projected cost. So in addition to paying for itself, our estimates predict that expansion will generate an additional $130 million over the course of 10 years. However, the first year of the program will require some upfront funding. Expansion has been estimated to cost between $125 and $164 million in the first year, and the legislature will have to increase the Medicaid funding this session to account for this increase for expansion. And they have several options to do this, including these few that you see on the slide. So just a quick overview of some of the options. First, we have the SHOP fee, which is a fee that's paid by hospitals, and the money's then matched with federal dollars. So there's actually a bill passed in 2020 that would have made this change to pay for expansion, but it was ultimately vetoed by the governor. But if it was to be passed again this year and signed into law, the fee increase could cover all or most of expansion. Next, we have some state savings. So with all the other benefits of expansion that I just explained, it's also going to bring some state savings for certain state agencies, such as the Department of Mental Health and the Department of Corrections. And some estimates put these savings as high as $131 million, which would again get us close to most or all of the cost of expansion. And then next we have the health insurance assessment fee, which was actually a fee that was paid by insurance companies to the federal government, but it expired last month in January. So the Oklahoma legislature could move to reinstate that fee on a state level to help pay for expansion. And lastly, there are several tax expenditures that aren't really doing the jobs that they were intended to do. So for example, the capital gains deduction is benefiting people that mostly make over $200,000 a year, and it's creating many fewer jobs than expansion will. So repealing that tax incentive alone would save $115 million for the state. And then repealing or revising other credits could generate another $60 million combined. But the most important thing to remember is that legislators can and should find this money without cutting or redirecting funds from existing public services. So on a slightly different note, as expansion is about to be implemented in July, the Healthcare Authority, or the OHCA, has taken steps to change the Medicaid program to a privatized managed care model. It's really important to note that Medicaid expansion will go into effect on July 1st, regardless of what happens with managed care. So no matter what, the hard-fought win of expanding Medicaid still stands. But these two issues are somewhat interconnected. So let's start with a description of what a privatized senior care would look like. Currently, OHCA operates both a fee-for-service, or FFS, program and a PCCM program. So fee-for-service is exactly what it sounds like. OHCA pays providers individually for each service they provide. So you provide a service and you get paid a fee for that. PCCM, or partially capitated care management, means that OHCA pays providers to manage care for some Medicaid members. And through this PCCM program, which covers 75% of Oklahoma Medicaid members, the state has already been managing care internally for 15 years with low administration costs and quick payment to providers. However, under the new proposal, all of that internally managed care would be outsourced to private insurance companies, and the state would pay them a set rate every month to manage the care of Medicaid members. So at first glance, this change might seem like it makes sense. Advocates for privatization often say that it'll save the state money while improving health outcomes. However, there's really no evidence to support that claim. Evidence of savings and better health outcomes from other states is mixed at best. In fact, it's actually likely that MCOs will have incentives to restrict care for some enrollees. Because the MCOs are paid a fixed amount per patient each month, they could be incentivized to deny certain services to keep costs low, keep costs under that monthly payment in order to ultimately make a profit. Additionally, the last time that Oklahoma tried to privatize senior care, many providers were forced to stop accepting Medicaid patients because of delayed payments and lower payment rates from the MCOs. And while this happened across all types of providers, it was particularly bad in the dental community. 90% of dentists actually had to stop accepting Medicaid. And if that were to happen again in the dental community or across all provider groups, Medicaid patients would have fewer options and may lose access to care. And this would be especially prevalent and particularly bad in rural areas. The OHCA also already has a really low administrative cost. It's one of the lowest in the country at about 4%. But MCOs can spend up to 15% on administration and nonprofits, which could lead to an additional $135 million in cost to the state. Similarly, what OHCA currently spends on providing health care for each Medicaid patient is again really low. So this is a lot of numbers, just bear with me, but when compared to surrounding states that use managed care, Oklahoma spends about $2,000 less each year on every enrollee. So that really adds up. And if Oklahoma's cost per enrollee were to increase to that average of surrounding states that use managed care, it could cost the state an additional $716 million every year. And finally, earlier we talked about one of the potential ways to fund Medicaid expansion being an increase in the SHOP fee. That's the fee that's paid by hospitals. And both legislators and OHCA agency officials have suggested this as an option to fund Medicaid expansion. However, the SHOP fee can't continue under a managed care model, so making this change, outsourcing managed care, would require funding for Medicaid expansion to come from somewhere else. The bottom line is that the actions of grassroots advocates like you and so many others are the reasons that access to care is improving in Oklahoma. Because of you all and because of so many other Oklahomans, 200,000 people are going to be able to see a doctor and fill a prescription in just a few months. This was a hard-fought win, and Oklahomans across the state should be really proud. But we also have to keep pushing to ensure that implementation is fully funded, that it's robust, and that it's accessible to everyone who is eligible. And the last thing I'll say is that healthcare doesn't happen in a vacuum. There are so many other factors that influence the health of Oklahomans, things like access to education, poverty, involvement with the justice system, food insecurity. All of these things intersect to play a part in our health. So if we want our friends and our neighbors to be healthier and to live as long as people in other states, we really have to start thinking more broadly about what our communities need. Oklahomans need access to healthcare, sure, but they also need to live in places where they feel safe. They need realistic opportunities to move out of poverty. They need access to healthy food, a good education, and so many other things. And all of these different systems can and must work together to provide opportunities to all Oklahomans. So with that, I'll say thank you, and I'll pass it off to my colleague, Nicole Poindexter, who is OK Policy's Outreach and Legislative Liaison. And she's going to talk a little bit about legislation that could impact Oklahomans' access to care.
Thank you, Emma. As usual, that was incredibly informative, and I learned a lot, as I'm sure others did. So as Emma mentioned, I'm Nicole Poindexter, the Outreach and Legislative Liaison. I work at the Capitol and beyond to affect OK Policy's legislative agenda. I would like to take a few moments to talk about 3 bills on our watch list that are currently in committee. First is House Joint Resolution 1091. That's HJR 1091 by Sean Roberts. This would create a new constitutional amendment to repeal Medicaid expansion in the state. In short, this would repeal all of our hard work on State Question 802. Currently, this bill is in the House Rules Committee and is not on the schedule to be heard at this time. The next bill I would like to highlight is House Bill 1091 by Carol Bush, which ensures that providers have certain protections should we move toward capitated managed care. As of tonight, this bill is in the House Rules Committee, but a hearing has not been scheduled as well. And that was a little bit of what Emma was talking about regarding the provider rates and some of the issues that we had previously with managed care. This bill would try and minimize that should we go to managed care. The final bill that I would like to highlight today is Senate Bill 695 by Rob Standridge, which prohibits the Oklahoma Health Care Authority from entering into contracts for managed care without the approval of the Oklahoma Legislature. Today, this bill is in Health and Human Services Committee and currently does not have a date to be heard. While none of these bills are currently on the agenda for next week, that is largely due to the unknown with the weather. They could be added to the agenda at any time. I have highlighted just 3 bills with bill numbers that we are tracking, but there are an additional 33 shell bills that we are also watching closely. Currently, these bills have only the title with no substantial language in them. And this could also change at any moment. At any time, a representative may add language to a bill through the amendment process. So please continue to watch our social media and your email for further actions you may take to support our efforts to ensure every Oklahoman has access to affordable health care. Thank you so much, and I'm going to throw it back to Kyle, our senior field organizer.
Hey, thank you so much, Nicole. So next, we have our question and answer portion of tonight's events. For those of you who are currently watching live, you can drop those in a live chat feature. And if you are watching this afterwards, or if for any reason we don't get to your questions tonight, please feel free to send those to info@togetherok.org. Again, that's info@togetherok.org with those questions post video, or if you have some questions that we're not able to get to this evening. In addition, if you go over to togetherok.org, you can sign up to join a chapter there. You can sign up for some of our action alerts. You can sign up for our emails. And in addition, you can also support our work from that website as well. So our first question for the evening is over to you, Nicole. And the question is, how do you know when action is being taken on a bill? And can we as advocates track bills as well?
Absolutely. By going to the Oklahoma Legislature website, you can sign up. You can all first go in and track bills and see where they're at. You simply just put in the number. So for example, we covered House Bill 1091 by Representative Carol Bush. You would type in HB 1091 in the basic bill search, and it would come up with all the information that you would need about that bill, including what committee it is in. From there, you can click on committees up at the top, and it will show you all of the committees listed, as well as the members and the staff that is serving those committees. There is an advanced bill search that you can sign up for, where I believe you can track up to about 10 bills. I'm sorry. You can track up to 10 bills, and they will give you updates on them at any given time. So that is a great tool to be able to track those bills. Also, Together Oklahoma is going to be sending out a lot of action alerts to give you updates on bills that are going to be fitting in with our policy priorities. But that's a great question.
Thank you. And our next question, I think, is geared a little bit more towards Emma. So Emma, will MCOs contribute any money to improve social determinants, or will MCOs just flood underfunded social service agencies with more clients?
That's a really good question. There are often attempts from MCOs. MCOs often say, we will invest in the community, right? But in the contract that has been awarded to certain MCOs, there aren't any requirements that happen. All of the language around that is about recommendation. So the state is asking them to do this, but it's not necessarily a requirement.
Thank you. And our next question is over to Nicole. So Nicole, the next question for you is, what are some things we as advocates can do to make sure the legislator passes good policy?
Wow, that is an excellent question. So legislators are human, and they often are very knowledgeable about issues that they have been taught or were raised around, but often aren't knowledgeable about a wide breadth of issues. So one of the first things you can do is offer to be a resource to your state rep or your state senator, especially on something you're really, really passionate about and knowledgeable about, because odds are you know more about that topic than they do. The next thing you can do is continue to be calling and creating a relationship with your lawmakers. So continue having conversations with them about issues you care about, but also maybe about things that they do well or things that you wish they would have done differently. So if they vote on a bill that you really, really like, reach out to them, have a conversation with them, tell them that you appreciate their vote. If they vote on something that you wish they would have voted differently, then have that conversation as well. But what you want to do is really create a relationship with your lawmaker where they'll take your phone call. And really, really good advocates actually become a subject matter specialist to their lawmaker. So if you're really passionate about ending domestic violence or ending homelessness or making sure that everybody has access to affordable health care, take the time to get to know your legislators and really build a relationship with them. And remember always, they are human and they're doing the best that they can.
Excellent. Thank you, Nicole. Our next question comes to us and is directed towards Emma. Is outsourcing of Sooner Care a done deal, or is there still an option to kill this before it's a done deal?
Yeah, that's another really good question. So there are still options for advocates to get involved in this process. There may be moves for the legislature. There might be a time for the legislature to step in and, sort of halt this attempt. So if you are passionate about this, it would be good to let your legislator know how you feel about it, because they do have the power to stop this change. So if this is something that you're passionate about, definitely reach out to your legislator and let them know how you feel.
Thank you. And the next question is for you as well. How might the rift between the governor and the legislature impact healthcare, including implementing Medicaid expansion and introducing managed care?
So I think that the important thing here is that everyone knows that funding Medicaid expansion is really important this session. So everyone in our state knows that this is in the Constitution and this is something that we have to do. And so I think it's less of a matter of like politics and more of just something that we have to do, and we have to continue to remind our elected lawmakers that the health of Oklahomans is something that they need to be putting, they need to have the health of Oklahomans in everything that they do. So I think, what the best thing that we can do is to continue to remind our lawmakers on all levels, from the governor to the legislature, that funding Medicaid expansion and making sure that it's implemented in a way that maintains accessible healthcare access for newly eligible and current Medicaid members. We need to remind them that that is a priority this session.
Excellent. Thank you so much. What's going to be the best solution for making sure that the governor, the legislature, and OHCA implement Medicaid expansion without putting up too many barriers to access?
These questions are so great. Yeah, that's really important. Like, we have to make sure that that Medicaid expansion is implemented in a way that everyone who's eligible can access it. So one of the most important things right now is the OHCA, the legislature, everyone needs to be figuring out how we do that. And one of the things that we can advocate for is for a comprehensive plan for Medicaid expansion implementation. So it goes into effect on July 1st, but it would probably be a good idea for people to be able to enroll in Medicaid expansion coverage prior to July 1st. So Finding things like that, if we can making a certain decision might make it easier for people to access care. And then contacting our legislators and contacting the OHCA and letting them know that this is something they need to be doing is going to be really helpful in making that happen and making sure that everyone can access their care.
Excellent. Thank you so much. And then Nicole, from the chat, somebody asked if you can mention the bills that you had spoke about one more time so that they can write those down and we can get that out there again.
Absolutely. So the first one is House Joint Resolution 1091. So that is HJR 1091, authored by Sean Roberts. The second, and that went over, that was HJR 1091 was to repeal Medicaid expansion. House Bill 1091 by Carol Bush, that would ensure that providers have certain protections should we move to capitated managed care. And then Senate Bill 695 by Rob Standridge would actually prohibit the Oklahoma Health Care Authority from entering into contracts for managed care without the approval of the Oklahoma Legislature.
Thank you, Nicole. We have a few more questions, and then we will wrap it up and move on to the next portion of our segment. But I just wanted to reiterate for those of you who might have just joined, if for any reason we don't get to your questions this evening, please feel free to send those over to info@togetherok.org, and we will get back with you as soon as possible on those questions. So we have two questions for Emma, which is, will MCOs contribute any money? When can Oklahomans start signing up for Medicaid as part of the expansion? I haven't seen anything from OHCA about this yet.
Yes, thank you for asking that. That's a great question. Currently, we don't know when Oklahomans can start signing up for Medicaid expansion coverage. That hasn't been released to the public. So that is, like I was saying earlier, that's something that's really important in making sure that people can access their care is making sure that they can sign up in advance of when they're actually going to start getting coverage. And so because we don't know that, it's really important that all of us continue to ask those questions. So contact the OHCA or, make a public comment at one of their meetings, asking them to commit to, doing more to ensure that Oklahomans are able to access care on July 1. And that would include opening enrollment prior to July 1st and, ensuring that there's a plan in place to handle the 200,000 new applications for Medicaid.
Excellent. Thank you so much. And then for the final question, it's directed towards Nicole. Nicole, what is, if one of our advocates, and now we're in a virtual space, so what if they were stuck in a virtual elevator with a legislator, or had a quick minute to catch them on the phone, or just had to send a quick email? What is one thing that you can tell them in a 1-minute elevator pitch to tell to their legislator or to reach out to their legislator and say?
Sure. So that would really depend on the topic. But if you only had a minute, first of all, tell them you're only going to take a minute, because they love when you stick to your timeline, because they're very, very busy and they're often running to the next thing. And I would just succinctly, very quickly tell them what you're passionate about and why it affects their constituents, because at the end of the day, that's who elect them and that's who they have to answer to. So explaining your position and how it affects the people in their district. If you have numbers about how many people it affects in their district or data to show them, which you can get at okpolicy.org on numerous issues, definitely show them how it's going to impact the people that they serve. And that would be my tip for just a quick 1-minute virtual elevator.
Thank you, Nicole. And with that, we are ready for the next segment of our evening. But again, I just wanted to reiterate, if we didn't get to your question or you're watching this after the live stream, please send your questions to info@togetherok.org. You can also visit our website, togetherok.org, to join a chapter, sign up for action alerts, sign up for our emails, and help support our work. Up next this evening, we have Angela Monson, who has been somebody working on access to healthcare for Oklahomans for decades in our state. She is currently the Outreach and Legislative Director at the Oklahoma Policy Institute, and my dear friend that I've had the privilege of working with. And prior to joining us as the Outreach and Legislative Director, she was our chapter lead for the Oklahoma City chapter. So, Angela?
Hi, Kyle. Good evening, everyone. Thank you so very much. And to Emma and Nicole and Kyle, you guys have done an outstanding job this evening. I think we all realize how important healthcare, universal access to healthcare for all is for every single Oklahoman. So we have to work really hard to make sure that the system that is put in place assures that people do have access to high quality healthcare services. You know, the Medicaid program and the Medicare program both have a way of kind of setting the bar, establishing the foundation for other insurers. So it becomes even more important that those programs, and in our case, the Medicaid program, is run effectively, is run efficiently, and that individuals have the access to the care that they need. So thank you, Emma, for sharing information that helps our audience and all of us understand why this is such an important issue. And to Nicole, thank you for the time that you spent at the legislature, working with members, making sure that they too have a good understanding of the things that we advocate for. And we do advocate for things that make families healthier, that make people's lives safer, that allow our families to thrive. So this discussion tonight has been about healthcare access. But we're going to have a similar discussion next week, as Kyle mentioned early on in the program on February 18th. And we're going to have other of our policy analysts come share with us about the importance of creating safe communities. And we'll have Nicole back with us to talk about legislation at the Capitol that we think is important to make sure that families have safe opportunities to live, and to make sure that people are treated fairly and equitably in our criminal justice system. So important. And on February 22nd, it's not a Thursday, it's a Monday. We also invite you to join us then when we talk about how we make sure that our families thrive. How do we make sure that our families have the economic resources that they need to take care of one another, to buy food, to buy medicine? How do we make sure in this case, in one of our priority issues, and I got to mention this because it's important to me, receive all of the tax credits and all of the tax benefits that they need. So as we work hard to make sure that the refundability of the earned income tax credit here in Oklahoma is restored and possibly even increased. Join us to learn more and hear more about ways that we can make sure that families just don't exist, but they can thrive and they can grow and they can be nourished so that they can flourish. We work hard to make sure that Oklahoma is the kind of state that we want to live in and that we want our families to live in, but we want people to come and live here with us. And that takes work. We do want to be one of those top 10 states. We would love to be and be able to say to the rest of the country, we're number one in things that are good, not number one in things that are bad, and give people reason to move here. But that means we have to take action to ensure that policies are in place and that our government is responsive to the needs of people, to ensure that people are happy, they're safe, they're well. They can be paid a wage that can afford a lifestyle so that children and families can be healthy and can buy the things that they need and maybe even enjoy some of the fun things that are offered here in our state. So we need you. If that's the kind of Oklahoma we want, it's just not going to happen by itself. So we've talked tonight about these policies. Together Oklahoma is going to engage in moving advocates from all across the state together to focus on this issue area tonight: healthy Oklahomans and Medicaid, our thriving families, issues that have to do with our tax structure, that have to do with finances and income, and safe communities, those issues that have to do with our criminal justice system. Those three focus areas, we want to develop a community of advocates so that we might come together, pick an area, pick two, pick all three, and say, I want to help ensure that the Oklahoma State Legislature passes policies that build us up, that provide opportunities, that present equity, that offer opportunities for people to be included. So I want you to give a little thought tonight to which area that you think you want to work in. What's your passion? Nicole said it. What are you passionate about? Find something that you are passionate about and join with us as we make a change here in Oklahoma. That's what we do together at Together Oklahoma. You know, a lot of times people say, oh, it's so big, the problems are so large, there's nothing we can do. Well, I think over the last few months, we realized there are a lot of things that we can do. And if we work collectively together, the outcome of those actions is positive. And we truly can make a change. We truly can make a transition in the government that is us, the government that is for us, by us, that is us. So we need you to engage in doing that. This is not the time to feel defeated. This is clearly the time to celebrate the success that we have, but to plan for the future work, to work hard, to really take the necessary action steps that result in the change that we all see, the change that we all want to be a part of. So again, I invite you to join us as we make Oklahoma a better place, as we together improve Oklahoma. Now, the last thing I want to mention is a very, very important date that I want you all also to put on your calendar. On March 4th of this year, we will all gather at the state capitol virtually. We will hear from state legislators. We'll hear from advocates on these issues. We'll hear stories about the importance of the work that we do and how it truly impacts individuals. We'll also have some little entertainment, so it'll resonate, I think, among all communities and all people in the state of Oklahoma, why it is important for us to engage. We'll again hear from those people who are directly impacted by our work, and that may be you in the audience listening, watching tonight. So we invite you to join us virtually March 4th. We'll begin at 10 o'clock. To hear. But then after we hear and learn and share with one another, we'll also assist you in making sure you have an opportunity to visit with state legislators safely and virtually. So this will be an opportunity for you to speak directly to the people that represent you, to speak to the people who are carrying legislation that we think is really good legislation, and it builds up families, and maybe some of that legislation is not so helpful to Oklahoma families. But you can voice your own thoughts, your own opinions. We'll help you do that. We'll help you. If you feel uncomfortable talking to state legislators, as Nicole mentioned, they're just people. I was one, just regular people. So we want you to realize that you do have the power. People organized, collectively take action, have the power that's necessary to make any and every change that we need to improve the lives and the livelihood of every single Oklahoma citizen. It is not going to happen without that. Every person who resides in this state deserves, has a right to high quality, accessible health care. Every person who resides in this state has a right to have affordable housing, food to eat. No individual in Oklahoma should go hungry. It's really cold outside. No person in this state should be forced to sleep outside. So we have a lot of work to do. But those kinds of things won't happen unless we, the people, come together and work hard collectively. So again, don't forget February 18th, 6:30. Don't forget February 22nd, 6:30. Don't forget March 4th at 10 o'clock, all virtual events, so you can learn, you can share, and you can speak. A friend of mine said, it's important that I use the word that we give a place for people who are voiceless to speak. And I was told, no, those people are not voiceless. They have a voice. They've simply been silenced. So we want to make sure you are not silenced, that you can talk, you will know what to say, and most importantly, policymakers will listen. Again, Kyle, thank you. I'm going to ask you to come back and join me. There may be things that I missed. We're going to let our audience go a little early tonight, I see, but that's okay. That may be the incentive that they need to join us again next week. So this has been wonderful. Again, I want to say thank you to Kyle. You've been wonderful as our host tonight. Emma and Nicole have done a fantastic job. And you might want to acknowledge some of those folk that the audience really doesn't see. And let me not forget, Anaway, Kali, Anaway, our fearless leader who's opened us up today, understands how important this work is. And we're welcoming her back to Oklahoma. She's been away for a while, but she's an Oklahoma native. So Anaway, thank you for the leadership and the guidance that you provide to all of us. Kyle, back to you, my friend.
Thank you, Angela. And I think you covered everything wonderfully this evening. Again, if you want to sign up for a chapter, advocacy alerts, or emails, please visit togetherok.org. And I also want to give a special shout out to our comms team who has been backstage this whole time, making tonight such a successful event for us, and our ops team at OK Policy for also making tonight such a successful event. And thank you to all of the advocates who have joined us live and all of those who are watching post-live event on our social media channels. Thank you for being a part of the work that we do. Thank you for the contribution of your time tonight. And like Angela said, we want to give you a little bit of your time back this evening. So thank you for watching and have a wonderful evening.